Hi, everyone. I'm Dr. Brian Glass, and this is another episode of the Diabetes Voices of Strength podcast. And today I have the honor of being joined by Patti Columbe, who is a fellow type 1 diabetic, and she's here to share her very unique story. Hi, Patti. Welcome.
Hi, thanks, Brian.
It's wonderful to have you here. So,
Nice.
let's begin at the beginning. Tell us
Okay.
your diagnosis story. When did it happen? What were your symptoms? How old were you?
Okay, so my diagnosis story happened in West Palm Beach, Florida. I was living there with my parents and my older sister, and we went on a vacation to Prince Edward Island, actually. So we were on a vacation, and during that vacation, I was sick before and after every meal. Of course, I had the frequent urination, or I just said I had to go pee a lot because I was 7.5 at the time. And my personality had changed. I was really friendly as a kid. I still am. That's just my personality. And I wasn't as friendly. I didn't want to play. I didn't want to go to recess. And my teachers started noticing. I was staying in at recess, saying I had a tummy ache in second grade. And this trip to Canada was a big factor. My mom noticed it. My family that was up there noticed it. And my mom went to a chiropractor in Florida, and she told the chiropractor what was going on with me, that I was going to the bathroom a lot, and he did a urine check in the office. I had ketones, and that was the start. Immediately, I got recommended to go to an endocrinologist, and they diagnosed my diabetes there. And I stayed in the hospital for a week. And after that, I came home. And at that time, I was in third grade. So I had a diagnosis in third grade, and that was 1986. So I'm 48 right now. But I was a little 8-year-old girl in Florida that when I got diabetes.
Wow. Yeah, I mean, it sounds like a very similar story to most of the diagnosis stories, but obviously it had been kind of creeping up on you for a while. And
Yeah.
um, what was your parents? What was their reaction to learning about your diagnosis?
My, I think that they were scared because at the time there wasn't it wasn't like now. There wasn't a lot of adolescents that they knew about. I was the only one. We had to look up what diabetes was. It was very new. But I have really smart parents, and they advocated for me, and they're supportive. And so they just started learning. They started learning all the things. My mom would go to classes, and then later, we would go together to support groups. But it was heartbreaking for my parents. And at the time I didn't fully understand, obviously, the gravity of it, but I just thought, I couldn't eat cupcakes anymore, Halloween candy. And it was in October. So I was like, what, I can't eat candy anymore. And that was my knowledge. But yeah, we had some moments, but all the pictures I see in the hospital, I'm smiling. What is that about? I'm maybe just smiling for the picture, but I don't remember it being as traumatic for me as it was for my family. Uh,
Sure.
you know,
Well, you probably didn't fully understand what was
I did.
happening.
I did not. I just knew I had to take shots, and we were practicing on an orange, and I had to watch videos in the hospital. And I do recall, I thought everybody else in the children's wing was really sick. Some people didn't have hair, and some people had lots of tubes everywhere. And so I felt like I didn't fit in with the other sick kids. When I walked down the hallway, visiting other kids, and I realized that something was very different. Am I sick? Because they look really sick.
So
So
you were in a ward with children with all sorts of maladies, not just
yeah,
diabetes.
that's right. Yeah, I remember meeting a girl that had cancer, and I remember just seeing people that had different things in their body that were noticeable, like on wheelchairs and things. And then there was me, just I'm reading notes for my friends, and I'm okay. I just I'm starting to feel better. I just so it was a very different reality for me. I thought, am I sick? What's going on?
Do you happen to remember your first bout with hypoglycemia?
I remember a couple times. One of the times was we were at, I think, like a health fair or something. Um, and I got overheated, and my
Mhm.
mom brought me some, they had like ice cream in a cup with a wooden spoon.
Oh, yeah.
And they still sell those. And I remember she gave that to me to like cool off, and that making me feel better. But that was like right before the diagnosis. I don't remember the first time. I remember lots of times, but
Sure.
no, I don't remember the exact first time. But when I look, we looked back and said, "Hey, when did this actually start?" At 8 years old, and it was like 7.5, where we could track different times where my sugar had been low or high.
Right. Right. Yeah. Okay.
Yeah,
Well, that makes perfect sense.
yeah.
Um, so tell us about how you were treating your diabetes when you were first diagnosed. You said it was when you were seven and a half, 1986.
Yeah,
Did
1986. So I was on regular and NPH, I think. NPH
right.
and regular were the insulins. I had one of those injectees machines that I could put the syringe in and hold it against my body.
Okay.
And this do regular shots as well. So I was doing insulin shots, and then of course the big guillotine finger pricker. I had that. I still have the blue one that just, kind of shoots it down at you really strongly. And we had to get a big, big drop of blood, like a
Right.
hanging drop is what they called it. You need a hanging drop of blood. And of course, the meters at the time were, they looked like Game Boys. They're really large.
Yeah.
And I still have a lot of that, the history of the technology at my house. But I didn't keep all of them, but I did keep the ones that I had as a young girl. So I still have those hanging around. But yeah, it was a lot of stuff, and I remember the bag that I carried it in was pretty large.
Do you remember how long you had to wait from the time you put the blood on the test strip before you got a reading?
Oh, I wanted to say it was at least 20 seconds, but it could have been way longer than that. So I don't remember, but it was long. I want to say at least maybe a third of a minute or even a minute. It was just a very long time.
Right.
Yeah.
I think my first one was like 30 seconds. But
Yeah,
of course
30
there
seconds.
was
Okay.
there were so many of them, and they all kind of differed. And I remember when they came out with one and you had like the reading in 5 seconds, and I thought this is fantastic.
Well, yes, this is like, oh my gosh, this is so new. And right, just to not have to wait for it. And we were always kind of trying to guess the number as we waited. Because it
Yeah,
was so much time. Yeah.
based on how you felt.
Yeah, or the machine would turn off and I'm like, "Oh no, I missed it." So I had to, turn it back on and look at the result, if you walked away.
Right. Yeah, because you have to wait so long to get that reading.
Yeah.
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 Yeah. No, that's it's crazy. So you've seen a lot of change during your time as
Oh,
a diabetic.
I've seen so much, yes, so much change. Um and I was asking you, Brian, too, in the late 90s is when I remember going on a pump and having Humalog, like the short acting insulin. And I don't know exactly the year it came out. You would probably know that, but that's when I remember starting it, and I
Right.
thought, this is magic. This is one of the miracles, is this short acting insulin that I could treat a high sugar really quick and I could correct really quick. That changed my world as a young college student. Is to have an insulin pump with
Sure.
short acting insulin, or even just a needle that I could take it with, or a pen. I thought short acting ins. I still do. I just think, oh, that is just a miracle. The timing of it. I could feel better quickly.
Right.
That
Right.
was great.
And then for people who were doing, multiple daily injections, when Lantus came out in 2001, that made a huge difference. I believe Humalog was 1996.
There
Um,
we go. Yeah, I was gonna say late 90. Yeah,
but I
so
don't I don't know
1996.
when it was effectively kind of in the hands of a large number of diabetics. That's a great
Oh yeah,
question. Yeah.
I thought it was so amazing. I really thought that it solved all the issues, short acting insulin, because I could eat whatever I wanted at that time, which was really changed college for me. But it was really scary because it acted so quickly as well. And you could overdose on short acting insulin, just like you can now. And I had a lot of those, as a new college student. I think on the first night in my college dorm, I had a seizure in the middle of the night, and the RA had to come in, like my first college experience.
Oh
And my
no.
my roommate moved out. Oh, yeah. She was like, no.
This is
So
the
I have,
first night. Well, so
the,
did someone find you and then
yeah. So we were both, we both spent the night that night, as the classes were the next day, and I had already informed the RA and my roommate about everything. But I think she must have thought that was going to happen a lot. But the exercise from moving in, and the whole day caught up with me, and that's actually how I qualified for the trial I'm in. So I just had a lot of low blood sugars, and exercise would catch up with me in the middle of the night, and that was, I feel like I was near death so many times in my life with diabetes. I mean, I'm sure other times with bad decisions. This was um, it was really scary, short acting insulin, but it was also, this kind of miracle drug. And it still is. I mean, insulin is amazing. It's an amazing drug. And I was so glad to have it.
did you suffer from hypoglycemia unawareness?
I did. So and when people tell me that, I always thought that meant that you just pass out or something. But I think part of me was just, I would ignore some of the symptoms, or I say OD. I would take too much insulin, or I just was overestimating, and so things would drop really quick for me.
Right.
But over time, I started to recognize, as my sugars got better, um, I didn't know if I was 50 or not. I was functioning at 50. And I didn't realize that I was low. And so I started having some restrictions for myself, as far as when I got in the car, I had to check my blood sugar because there wasn't a CGM at the time. So check my blood sugar before I got in the car, and check my blood sugar before I went to bed. And I had to make sure my blood sugar was 100 or over, or I would eat a snack. And so I started gaining a lot of weight as I was scared that I was going to go low in the middle of the night and have one of these seizures, like my first day of college, where somebody else had to wake me up. And of course, I didn't remember any of it. They just said, Patty, we were giving you the juice, and I wake up to all these people in my room.
Sure.
And I have no clue what happened. I didn't know where I was because I was in a new place, and but my roommate did end up moving back in, but there was a good time that I was alone in college, and that was fun too. So.
Did you ever wake up in the hospital?
I never woke up in the hospital.
Okay.
So I actually had a lot of people save my life over the
Yeah.
years. My parents, my sister, people at camp, diabetes camp, the RA. I lived on my own without a CGM, because they weren't made yet. And I did. I mean, I was successful. I'm here.
You're still here.
I had lots of different apartments. I never had a roommate. I was always able to afford it, and I didn't want to be a burden to anybody either. And so I lived alone in different states, and I was successful with it. I've had a lot of alarms and things that I put on, but yeah, I just did it. I just did it. I'm surprised I'm here, actually.
Yeah. Yeah, well, I've always told people that when people ask me what's it like to live with type 1 diabetes, and especially back then, I felt like I was kind of living on the edge of extinction.
Yes. Yeah, that's exactly. I'm like, how did I continue on, and also, have a job, and have relationships and date, and all the different travel. How did I do all those things successfully?
We didn't know
I
any
did it.
better.
No, I just, yeah, okay, I got to do this, right? I'm going to do it.
We did not know any better. It's
We
gotten
did
much
it, right?
easier. It's gotten so much easier. In fact, people who are
It has.
diagnosed today, they do not understand,
No.
what the struggle was like, and just like we don't understand what it was like for those first people who were diagnosed and got insulin in the 1920s and 1930s, and they couldn't check their blood
Yes,
sugar and
that's
using
right.
urine
Yeah, they're just,
strips.
using urine strips. And I did use those. So that was part of my childhood is the ketone strips.
Yeah.
And I want to say it was almost every morning that I would use it. I remember they were like in the bathroom, sometimes on the back of the toilet, where you
Okay.
might keep extra rolls of tissues or stuff like that. So I remember always seeing like a bottle of ketone strips
Uh-huh.
that I was using as a little kid. And it wasn't just when I was had a high blood sugar, but it was always when I had a high blood sugar was go check to see if you have ketones. And I know
Right.
now they can do it with, your blood. But yeah, I was always using those strips. I
Yeah.
think later people were using them for maybe protein diets or something, but
Well, and supposedly there's a brand new Libre sensor that is either about to come out or it has come out that is going to test not only your sugar, but it's also going to test you for ketones.
I love it. So
Yeah.
even better, you
Yeah.
can, check both. But it seemed to be, that was like a really big thing, to try not to get into DKA and to be drinking my water when my sugar was high. I always thought you only got them when you were high, but I know that's not the case. So, but I was always testing them when my blood sugar was high.
Right. Right. Yeah. Exactly. Yeah. And just like we would only, we tend to, yes, there'd be certain times when we would test our sugar, usually before we ate, but in the middle, in between, about the only time we would test is when something felt off. We felt low. We felt high. We didn't know all the time what our glucose was.
No, and I remember even now I'm actually teaching in the diabetes self-management education group at work, and I see a lot of type 2s and they have these regimented times that they check, and we definitely talk to them about CGMs, but I always told them, I said, if you're only checking when you don't feel good, then your meter is just going to have these like really high results or really low results. And that was kind of the case for a long time. I'm just going to check when I don't feel good. And then
Right.
all your results are just really wonky.
Yeah.
I mean, it's not a good summary.
No. No.
People do that.
So tell me, when did talked about getting your first pump? What was your first
Yes.
CGM? When did you get your first CGM? And do you remember what it
Oh,
was?
okay. It looked like a little clamshell.
Okay.
And it was after it had to be after 2007, I think. So,
Okay.
so oh my gosh, in the past 20 years, thinking about history. And the reason I say that is I remember having it at diabetes camp here in where I live, and we didn't move here. My husband and I moved to Eastern North Carolina when we got married in 2007. So I'm
Okay.
trying to think of the date, but it was a little clamshell. And I don't believe the receiver was on my pump. I think it was somewhere else, but it's funny that I don't have as good a recollection of it, but I did have a CGM and I used it at camp, and I was one of the only kids with it at the time.
Okay.
But I thought, oh, this is great. So I don't get low in the middle of the night.
Right. Right. Yeah. Yeah. So, yeah, very early on. Of course, it's fascinating to me how quickly the CGM technology changes.
Oh, it does. Yes. And I'm wearing one now. So for this clinical trial, I wear the Dexcom G7. That's
Okay.
the one that they're partnered with. Yeah.
Okay.
Forgive my dog there.
Yeah. Yeah. So you've mentioned trial a couple of times. Now it's time to
Uh-huh.
do the big reveal because you, Patty, are part of the Vertex trial, which is
Yeah.
ongoing right now. And tell us a little bit about that. Tell us
Okay.
about your journey because you are effectively no longer a type 1 diabetic.
I know. So, oh my gosh, what a journey. I'm still on the journey. So this is, I haven't got off the train. Wow. So this journey began more than 1 year ago. So, I found out about Vertex through a friend, and Chapel Hill named Veronica, and she was a nurse working with some islet cell transplants, believe it or not. And she was one of my best friends in high school.
Okay.
And she told me about it when reunited. And she said, Patty, we do some islet cells, but it's for people that are really sick. And I was like, can I get in? Can I be really sick? How can I get really sick? And so I started looking stuff up. And as soon as I met with her and I started looking on the internet about islet cells, and I came upon the screening site for Vertex, and I called, and I got a call back finally, and it did take a while. Clinical trials sometimes get really busy, and but I did get a phone call from Vertex from a site in Virginia, and they did a over the phone screening, and I was disqualified right away, and I was devastated.
Yeah, why were you
Uh,
disqualified?
my BMI was too high, so my
Okay.
height weight ratio, I was too heavy at the time, and I thought, oh my gosh, this is going to disqualify me. This is something you can change. You can change your weight. So they said, give us a call back when your BMI is 29 or under. And I was
Okay.
like, okay, I'm going to do something about this. So I made a big effort to get my BMI, which is something you can change, under 29, and I got healthier that way. And then I gave him a call back. And when I did, I didn't get a call back. And I thought, I just lost all this weight.
But it was a
And
good thing. It was a good thing. So
it was a good thing, but I was so motivated to hopefully get in a trial with these islet cells my friend told me about, and I looked at, and I just didn't get a callback right away. And I realized now that I have more information that site had changed a little bit, and so they had paused the trial at that time, and so that's why I wasn't getting a call back. But I continued to have it as a focus. And I was still losing more weight. It took a long time since I couldn't be on a GLP-1 or anything. And I was just using all the tools I had from years of, crash diets and everything. And I said, you know what? I need to get healthier. I need to be healthy for surgery. It was all a positive. It was just frustrating
sure.
because I thought, man, I would have been working on this if I knew this was an obstacle.
All right.
Um, yeah, I just thought, man, body positivity didn't work for this one. So I lost the weight. I found someone online named Hannah, and she was posting about her islet cell transplant.
Wow.
And she was in a support group that I followed online. And Hannah she was saying how she had success with an islet cell transplant. And I thought maybe she was in the trial that I wanted to get into. So I direct messaged her and I said, hey, are you in this trial? And right away, she started messaging me back. She said, no, but I know my doctor does those trials. And she gave me the name of Dr. Wachowski in Chicago. And I emailed him and I told him my life story, like I just told you, my diabetes story, not my life story. And right after that, I got a call from Dr. Wachowski, and he did a quick screening over the phone at the time, and he got me in contact with his other nurses to do more screening. But it was so rewarding to have a phone call from the surgeon
All right.
and to have an answer after over a year of trying to lose weight and find out. But it was a different site. It was Chicago. They were actively recruiting for people to get screened, and I made it. I made it into the screening.
Okay. All right.
Yeah.
And you are one of how many in this Vertex trial?
So initially it was one of 50. Now I'm one of 52 in the world.
Okay. And
Yeah.
so you go to University of Chicago,
Uh-huh.
and
They fly me up there
they fly you up there, and then they
with my
transplant.
service dog. Yep, and my husband.
Okay. And so they fly you up to Chicago from North Carolina.
Mhm.
And then tell us about these cells, because a lot of people know about the Eledon trial where these are cadaver
Right.
cells, but the Vertex trial is different. So tell us about your
Very.
islet cells.
Okay, so what I understand about the islet cells, since I'm not a nurse, but my understanding, what I've learned is that they're embryonic derived islet cells. So they took these cells and they replicated them in a lab in Boston. And they taught them how to be islet cells, beta cells. And so they took these stem cells and that were ready to learn, and they taught them how to be islet cells. And when these cells had learned, however they do it in the lab, then they did a QA check, and then they were ready to be transplanted into a live donor, which was me.
Uh-huh. What you said this is being done in a lab in Boston. Is this like the
It is
Vertex laboratory? Are they doing this at Joslin? Where's this being done?
the Vertex Pharmaceutical Lab that and how these little bits of information I learned along the way, because I said, where are these cells? And they're like, in
Sure.
Boston.
Okay.
And yeah, and I said, well, how are they going to get to me? And they're like, there's going to be a person driving them to the hospital after they get checked. Every one of them has to get checked before they come. And
Do
so
they
even on the
drive
day of
them
my
from Boston to
they,
Chicago?
yeah, I thought they're gonna fly him and get
Yeah.
off the plane. But on my journey, they were being driven. And so whoever drove that car, I'm very thankful. They drove my cells and they got here safely. And but that's what I know. So if the story's any different, I do like to exaggerate sometimes, but that's what I remember is them telling me that they were made in Boston at the Vertex lab. They were quality assurance checked, every one of them, and then somebody drove them over to use Chicago, and I'm sure they got checked again there. So
Right. Well, that is the journey of your cells.
that's the journey,
So
yeah.
so
And now
how
they're in my
many
body.
how many of these lab derived stem cells, islet cells, do you have in your body now?
8 million. So I
Eight
have 8 million
million.
cells. And so during the transplant, I could actually see them. I could see or the substrate that they were in, but it was in like an IV bag, and I could actually see them. I mean, the bag was see-through, so I could see the substrate kind of coming into the tubing into my body, which was it was just amazing. And they showed me they gave me a T-shirt that had a picture of the cells under a
Oh.
microscope and what they look like, and I still have that T-shirt upstairs. So
Oh, that's fascinating. You should definitely
yeah,
send me a picture of
I
that.
I know I'll go grab it. um, but yeah, so they said, you're going to be one of whoever many people are going to get that T-shirt right before they get the cells. But those were a picture of my islet cells.
Okay. All right. So
Yeah.
when did this happen for you? When did you have this transfusion, if you will, of
Yeah.
islet cells?
So I had the transfusion on or the transplant February 11th of 2025. So a year and some months ago.
Okay.
Um,
And are
yeah.
you are you off of insulin now?
I am off of insulin. I've been
Okay.
off for almost a full year. So I was off of short-acting insulin on August 1st of 2025 and long-acting and short on September 3rd of 2025. And those dates stand out to me so much.
Yeah, those are dates that stand out. Usually, like your diagnosis date.
Yes. And I don't know my diagnosis date, but I know it was in October
Yeah, but
of
you were
86.
seven and a
Yeah.
half, so it makes
Yeah.
sense.
Yeah.
Yeah.
But I just remember it really affected Halloween. So it had to be in the early months, before Halloween.
Yeah.
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 And full circle, I think when I came back, so last Halloween, so last year's Halloween in 2025, we celebrated. And so it was a lot of things have been full circle for me. But we celebrated at Youth Chicago, and they took a big group picture of me, and Dr. Wachowski posted that on LinkedIn, and I shared it as well. And I have my husband and my service dog in the picture, as well as my nurse Hannah and my other amazing team and nurses there. But
It's just
yeah,
it's an amazing story. Amazing story.
thank you.
So, all right. So you went off of insulin, but I
Hmm.
think I heard you say earlier that you are still on a CGM. Is that correct?
I am. So yeah, so Vertex, a part of the contract is that they're collecting data the entire time that you're in contract with them. And so I wear the CGM and I transfer the data every week. So every week I plug it into my computer and they can see my data. And so I'm constantly on a CGM. So I still feel like I'm in the diabetes life because I'm talking about diabetes. I'm wearing a CGM, but I don't look at it anymore. It occasionally I'll see the number, or if I get a 100, I get excited. That's still that unicorn number is great to have, but I don't have lows and highs. It's not the same.
What is your
I
what is
might
your
see it go up.
hemoglobin? What is your
Uh,
hemoglobin
so
now?
so 2 weeks ago it was 5.7, 5.7, I think, or 5.6. Yeah, 5.7.
Okay.
And I said, oh no, I'm pre-diabetic. I need to get it down. My first one was the lowest one since the trial that was recorded was a 5.5.
Okay.
And then, yeah, and so I just thought it was going to keep going down, but I quickly realized that my diet affects it. And I already knew this, but I'm just in la la land here, just in this optimistic place where I'm just thinking, everything is golden right now. But really, having the cells has made it so I'm making insulin, but I still have to eat a balanced diet,
Sure.
so I don't have fluctuations. And people that are not diabetic have fluctuations when they eat cheesecake or lasagna or rice, and it's temporary. So I noticed that it would be a temporary high, and then it would quickly go like the spike of my glucose has changed. It's rounded instead of peaked.
Oh,
And I think a
interesting.
lot of people might like that. So, and I like to talk about that. So it's like it's a little wave. Before it was like this, it was like a triangle.
Right.
And now it's like a little pebble in a pond wave.
Okay.
So, and I've been calling it the kiddie roller coaster instead of the adult one.
What is the highest? Yes. What is the highest glucose reading you've had post transplant?
Oh, on the CGM, I want to say it said 202 one time, and I
Okay.
was like, is that right? Um, and then quickly it went down. Dr. Mikowski told me not to look at the readings as much, because it's interstitial fluid, but it's also, since I'm a non-diabetic wearing the CGM, so I don't know if I trust them as much, but especially with my A1C, it went to 143 during my last mixed meal tolerance test. That was the highest it went. So I can trust that because it was a blood test, done very meticulously for the trial. Every
Okay.
30 minutes they took a drawing and they would check it. So,
Yeah, well, so what
but
is
my
it? What is a? Sorry to interrupt, but what is a mixed
yeah.
meal tolerance test?
Okay. So it is the test. A lot of women, moms might know this. Uh, you would drink like a lot of carbohydrates, like maybe 60 to 90 grams of carbohydrates in like a shake, and then they will test your blood sugar. Usually for gestational diabetes, they
Oh,
do it like in a couple hours. But for mine, they did it over 4 hours. And so I have a catheter in my arm and they're doing a blood draw every half hour and they're taking all these vials and they're getting readings of oh so many things, my kidneys, and just a lot of different levels of readings. And I do this for the trial. I've done it, obviously I say every year, it's only been a year and a half, but um, I've done it several times, and maybe 3 or 4 times I've done
okay.
this test, and they're looking to see if I have C peptides,
Right.
if I'm making insulin, and how high my sugar gets without external insulin. So
Right.
on those right now, I think 143 was the highest. Um, but on my CGM, sometimes I've seen it go to 180 or 200, and it's usually after Black Forest gummy bears.
Interesting. Okay, so you found your nemesis.
I did. Man, those are hard. I mean, they come in this big bag.
Oh yeah.
And everybody at work is like, "Oh, you got to stop eating those gummy bears and gummy worms." I can't believe it. They're just delicious and so many carbs. It
Right.
raises my sugar, and of course, that would be like a low snack. You'd have maybe a handful of those for a low snack, and I'm eating them now, going, I don't feel any different. I don't feel high,
But you
and
don't have
so
lows anymore.
I
So
know, I know.
Doesn't give you don't have the excuse to eat them now.
I know. I thought, oh, is this what people do? They just like go buy candy and just eat it. I don't know what people do. But I went in and I said, I don't really care about the candy bars and stuff. What do I want to eat? And I wanted to eat rice. I wanted to have a margarita with a sugary base, and I wanted to eat some gummy worms and gummy bears. Of all the things, if I was 8 years old, I don't even think I liked gummy anything then. But yeah, there's a couple Black Forest gummy bears and Albanese are my two favorites at this moment.
Okay.
I have to be careful. My weight's gone up.
Oh yeah, because you don't want to then wind up a type 2 diabetic.
Oh, and I've joked about it. I'm like, oh no, like I'm pre-diabetic now, because I went up to 5.7. I'm pre-diabetic. But I know my A1C will go down as I start to figure out food again. It's been a big journey of food and eating healthy because I want to, not because I have to.
Right.
And so that's a whole new showdown for me.
Sure.
Is that I realize that everybody has to eat healthy, but before it wasn't a choice, and so now it is a choice, and that just puts perspective very differently.
So now, the transplant was 8 million of these stem
Islet
cell
cells, yeah.
derived islet cells.
Hmm.
Are they able to check and see if you still have the 8 million cells? Is that
Oh. Uh, I don't know. I don't know if they can see how many cells are still there, but I believe, or logically makes sense, is that, I'm producing enough to keep my blood sugars in range. And so if I didn't have it, I mean, they expect a lot to die. So as soon as they're implanted, they don't expect all of them to survive. And so that's why it's such a large amount. But it's larger, I believe, than you would get from cadavers. So I don't know if it's maybe 2 million. It's a lot less than you can get from two people that have passed if you were going to get a cell transplant. So I have a large amount because they can replicate them and get them, and it is not derived from humans dying or I don't know how else to say that, but
right?
it's not cadaver derived. So
Not donor derived.
not donor derived. There you go.
Yeah.
Not donor derived. And yeah, so a lot have already died, I'm sure. But I'm just glad to have received a large amount. So hopefully I can keep them in. And I am on immunosuppressants, and those are going to keep my cells living. And if I wasn't on them, then they would die. My body would attack them. So I don't know how many my body has attacked successfully, but so far I'm a success in this trial.
Okay, well, that's
Yeah.
fantastic. So you just mentioned it. This is always the elephant in the room when we talk
Yes.
about transplants, and that's immunosuppressants. And
Oh yeah.
the Eledon trial is using tegoprubart, which is
Yes.
not FDA approved yet, but is
Right.
supposedly not as harsh on the kidneys as is tacrolimus. So
Right. And
which
I
of
do
these
take
so,
tacrolimus.
okay,
Yeah.
so that's the big question I was going to ask is which immunosuppressant are you on? And it is tacrolimus.
That's one of the ones. So I've been on that one consistently, and I was on sirolimus as well. And then I switched to my Fortic so I take my Fortic and tacrolimus. I believe I'm having success. I haven't heard otherwise from my doctor. The dosage has ranged, so it has been higher and lower at times, depending if I have any side effects from the medication.
Uh-huh.
And there's a laundry list of side effects. I take a mild amount of this immunosuppressant, so it's just enough so that my cells don't overtake. Excuse me, yeah, my body doesn't overtake the new cells. But as much as I hear from my diabetes friends and from people that may comment on posts, is that a lot of people say, I'm going to wait till there's no immunosuppressants. That's when it's going to be a cure. I disagree. It's a cure for me, and it would be a cure for anyone. I think it's more about everybody just wanting something now and hoping for it. And we're critical because we're like, where is it? Why don't I have it now? There's a lot of smart people out there. Why can't I have this? And why is it so expensive, or will it be expensive? But I think in all my interviews, I've called them my magic pills, and I really feel that way. I feel that they are this divine drug that I can take. So my experience with immunosuppressants so far has been really successful. I know the risk over time at taking any medicine for a long time, especially one that could possibly damage things. So I'm not ignorant. I'm just very optimistic, and so far, so good.
So then that brings up the question: how do you take these immunosuppressants? Because I know that with tegoprubart, I spoke with Katie Beth Hand, and she has to
Yeah.
fly to Chicago once every 3 weeks. It sounds like
Yes,
you're
and
not
she
having to
does
fly
it.
to
She does it,
Chicago
right?
once every 3 weeks.
And I bet she says, "I don't care. I'm just gonna go."
Yeah.
So I take their pills. So I take them in the morning and I take them at night. So I take them 12 hours apart, and I take them with my vitamins. So
Okay.
it's a handful of pills. It's, I want to say, maybe 4 to 6 pills in the morning and 4 to 6 at night. They're small pills. They look like little Tic Tacs. Two are like little round pills. And I take them in the morning, I take them at night with my vitamin C and whatever else, any meds that I took before. But it's very easy. They don't taste any kind of way. They're just in my pill container. And now that I'm an aging adult, I thought, oh man, now I have a pill container. But it's one that I cherish because it's keeping my cells alive, and I absolutely love them. I would love to be on tegoprubart if it is approved in the future. I I will wait in line just like everybody else to get on that one as well. So um, I think it's amazing. It sounds amazing. But both of our clinical trials are in the trial stage and at different
Right.
stages. And so, but I have just as much hope to be on that drug as well, if possible in the future.
Or maybe just switching to that drug.
Yeah, switching to that drug. Yeah,
Yeah,
yeah, I'll
yeah,
switch to that
yeah.
one.
So then that, of course, you hear diabetics talking all the time about, oh well, yes, I want a functional cure, but I'm not going on immunosuppressants because I don't want to deal with the potential side effects of that. In terms of the potential side effects, is
Hmm.
your kidney function being constantly tested?
Yes.
Yeah.
Hmm.
Okay.
No, nothing so far.
Nothing has
So,
happened.
no, yeah, and in fact, Dr. Mikowski says your blood looks better than mine. So,
Okay.
um, and I feel great. Sorry, that's my new puppy.
Ah,
So I feel really good, and I'm not as worried about those things. I know it's a reality, so I know, as I go through this trial, they're going to be checking it just to ensure I'm okay. Um, the worst case scenario is that I'd switch to different immunosuppressants, right? Ones
right.
that had less of a, maybe a kidney altering or something. But I'm going to try this out until my body says no, and I'm willing to do that.
Right.
I'm taking the risk. I'm willing to do it. I want, you only live once, and I have this experience, and it's been so profound for me that even if I did pass, I feel like I've made a difference. Like if I passed from this, it's a risk that I was willing to take. And I did have to sign a
Wow.
contract that said you could die. What? Oh,
Really?
okay, we're all gonna die. Yeah, I'll die doing something neat.
Because because
Um,
because of because of the tacrolimus?
just, I guess any clinical trial, it's a trial. We don't know what's going to happen to your body, and it's a possibility that, that it could be traumatic to your body. Um, so there's that, but I don't know exactly what it would be. But they always, they have you sign, like,
Sure.
just like going to a haunted house, like you could get a heart attack.
Right. Well, I think it's also just a very powerful testament to how awful it is to live with diabetes. And I think that a
It
lot of
is.
people just don't
Mhm.
understand the the constant the constant hell that
It
living
is.
with this disease is.
Thank you. It is hell. It is.
Yeah.
And I recently said, I felt like my suffering was taken from me.
Right.
Because I have been suffering, and I don't really I didn't think about it like that until it was gone. Because
Right.
some days were fine. some days were it was fine.
All right.
It was more of all the moments that weren't fine.
Yeah.
But I really my positive mental attitude is really what's in my faith, I think is what's driven me. And I've had a lot of support, but I've had friends that died of type 1. I've
Right.
had two that I were their phone numbers were in my phone, kind of,
Yeah.
and I could go see them. And so seeing friends that had distress and didn't have great care, or they just it wasn't working for them.
Yeah.
It was really hard for me, and I never thought I'd have an issue like that. I thought, oh, I take my medication on time, and I do all these things. I do the best I can, but it could happen.
Right.
We could be dead in the bed any night, and I think all of that was playing in the back of my head somewhere. But I got to tell you, I signed that contract. I didn't even want to read it. I'm just like, give it to me.
Yeah. Yeah,
I will
you'd
do
had
it.
enough. You'd had enough. I mean, you'd been
Thank you. Yeah,
diabetic
I've had
for
enough.
almost 40 years at that point.
Yes. Yes.
So,
And I
okay.
just said, I'm done. Yeah. I was
Yeah.
like, you want to take my arm? Well, I don't want to, I didn't want to be an amputee. But I was thinking, what you want my firstborn? Like, I
Yeah.
just don't want it. I don't want
Yeah.
diabetes anymore.
What was your hemoglobin before the trial?
Oh, so at the time I had to raise it up actually a little bit. So they had some regulations. I think now you have to at least have a 6.5, diagnosis of diabetes. But I had to be a 7.5.
Okay.
And mine it was like bordering that. So, I remember to qualify, it had to be a 7.5 that at that time. And they have changed it since. Um, because as we know, if you have a lot of low blood sugars, your A1C can look a lot better, um, over time. But 7.5 when I got the cells.
Wow. Okay.
Yeah. And I think in my lifetime with diabetes, the only time I was hyper focused and really disciplined, the lowest I got was a 6.8. And I had so many lows. It was not a successful 6.8. It wasn't like a normal straight line all the time. I mean, I was eating carbohydrates and I was taking so
Right.
it was like I just had a lot of lows.
Right.
And but I was still proud of myself because the number meant so much. In
Yeah.
our
We
community, the
we're
number means
fixated
like
on that
so much.
number. We are
Totally.
fixated.
And I was like, I don't get the sixes.
Right.
And not the sevens anymore. And of course, type twos think it's, oh my gosh, that's horrible. You have a 6.8, and because it's a different disease, excuse
Right.
me. But yeah, 7.5, and now it's a 5.7.
Now it's a 5.7. Yeah, that's fantastic.
It's the
So,
opposite. The
okay.
numbers
So,
are opposite.
I mean, I was thinking when you were saying, like worst case scenario. My idea of worst case scenario was, oh, it just stops working, right? The tacrolimus
Hmm.
is not protecting those cells, and your immune
Yes.
system kills them off, and
Hmm.
you're back to being a type 1 diabetic again.
Yeah,
Do
that would be
you
pretty bad.
do you think about that?
I thought about it and I said, I already know this. So if that happens, it'll be traumatic, but I already know diabetes. So,
Right. And
I mean, that
you've
was
had a
it. I was like, oh,
vacation. And you've had a vacation.
I had a year vacation. And in fact, when I was praying about it, I said, even if I didn't have diabetes for a day, that's what I said out loud.
Yeah.
Um, how great would it be to not have diabetes for a day? And
Yeah.
then it was like, wow, I don't have it for a week. And now it'll be a year. What is it? Today's the 12th. So it's already been over a year of no short acting insulin. And just in a couple weeks, it'll be a full year of no diabetes.
Yeah.
And there's no words for it. I don't know the words for it.
Did you cry at
Um,
all when you got off of
oh,
insulin?
oh, oh, I cry all the time.
Okay.
I'm very emotional. Or I should say I emote easily. So as soon as Dr. Wachowski said, Patricia, no more insulin, I got off the phone with him. My husband and I were together. We were sitting on the couch with this call to him, and I fell to my knees crying, and then prayerfully crying, and my husband was just rubbing my back.
Yeah.
It was so, it was a moment I'll always remember.
Yeah.
Yeah, I just said, what? A diabetic that doesn't take insulin? And, and I realize that there's some type ones that are like Olympic athletes and they might take like 1 unit or something, but they still have to take it. They still have to take something, right?
Sure.
Or if you're in the honeymoon phase, you might not take insulin, you still have diabetes. Um, or of course, with type twos, if you're in remission, you're not taking any, but for a type one to not take insulin after like everything was insulin,
Yeah.
I'm still processing it, Brian.
Yeah.
I have not fully gotten that yet. I mean, you're catching me at not even a year yet, almost a year of both. And I don't know how to write it down.
No, I know. It's words can't describe it. I mean,
No, and I hope there's many more years. I really, I sincerely believe that these cells will continue to work in my body. And I have, I have talked to one person in a clinical trial, an islet cell trial that's not in mine, but another islet cell from cadaveric cells. And they got COVID. And to get rid of the COVID, they had to get off their immunosuppressants. And so they did get diabetes again. And they had to get more cells. And since their cells were derived from humans, they had to wait for a blood match. And then as soon as they came up, they had to quickly fly. There's no notice. You just have to get up there and when someone passes, there's only so much time
right.
for those cells. And so they're always ready, but I got a call from them and they said, I got new cells.
Oh,
So
right.
yeah, so they only went so many months having to relive having that. But Brian, my idea working with Dr. Rakowski is that he loves his patients so much. I feel so cared for by him
Sure.
and the team that if my cells for some reason had something similar happen, that I would be able to derive more cells so that he could, I say top me up so he could tell me. So, and since I'm already on immunosuppressants, my body would be ready to receive cells if I continue to take immunosuppressants. So, yeah, but it does take, several days to get your body ready for the cells. It's not like they just put them in.
Right.
They have to prepare you so your body doesn't reject them. So,
have you had any side effects from the immunosuppressants?
I have, yes, I have had some. And let's say the common one that I wasn't sure if it was more psychosomatic, but I definitely felt it was the nauseous. I had some nausea. I don't anymore, and I'm on the same drug, so it was temporary. But I had nausea that I would take some medicine for, or I would do like ginger chews. But nausea, I've had nausea with diabetes, so
Right.
I can handle nausea. That was, I'm not vomiting. I'm just, don't feel that great. But so I thought that was really tolerable.
Okay.
So I would do it again.
Okay.
Yeah.
Fair enough. Fair enough.
Yeah.
Well, and I think one of the coolest things about this is that, you were diagnosed at 7.5. You don't have probably a lot of memories from before you were a diabetic. Most of your life has been as a type 1. Now you're getting to live a life effectively as a non-diabetic.
Oh,
And,
what is that?
And it's like, what does that feel like for you in comparison?
Freedom,
Yeah.
stillness, some peace. Yeah.
Serenity.
It's emotional. It's emotional.
Yeah. Yeah, I get it. I mean, if you cured me tomorrow, I think I'd cry for a week.
I did.
Yeah.
I did, Brian, and I wish I could just stick these cells in you right now. If I had that wand, I want all my friends to have them. I want I want everybody to be interested. I want everybody to be in a clinical trial if they're willing, because we need more people to
Right.
do it. We need more people, healthy bodies that are willing to take a risk to try out these drugs and to take, to say, hey, this could hurt me, but what if it helped me? What if it helped me? And
Right.
that's what for me it was. What if this really can help me? I was always optimistic about it.
Right.
I did have a point where I thought, is the I say, is the shoe going to drop? People ask me that a lot. Excuse me. They would ask me and say, "Hey, Patty, are you wondering if it's going to stop working?"
Yeah.
And I said, of course." But I also, I'm not one to think that I'm going to get murdered every day or my car's going to crash. I don't think of the realities of all the negative things in life. I don't. I know they're there, uh, but I don't focus on them.
Sure.
So that's my character or personality,
Sure.
and I've always been that way. Of course, I can get negative like anyone, but
Yeah.
that doesn't serve me in the same way. And so the whole time I just said, "Oh, okay." I would talk to my body and I'd say, like, these cells are, I'm doing this on purpose and this is good for you. And I would actually have that kind of conversation with myself.
Sure.
And, just to calm myself and to have the best perspective, I guess.
Right. That's the best way. That's the best way to go about it.
Yeah.
So let's go back to when you were still a functional type one diabetic.
Yes. Okay.
For our last few questions here, and how did being a type one diabetic affect your mental or emotional well being?
Oh my gosh. So I always wondered if I had depression or diabetes distress. I had gone to counselors and things in the past, and I had been on different medications for anxiety and such. But then this kind of like stopped. And so I thought, was this maybe just diabetes distress I was going through, having a chronic illness all the time, or was
Right.
this something in my brain? So recently I decided to go back and kind of revisit with all I've been through in the past year. I'm like, maybe I need to go talk to someone that knows, went to school and can maybe help me with that. So I just did that, say a couple of weeks ago, and it
Oh,
was great. I was so glad. I'm all about mental health and mental health
yeah.
awareness and going to talk to somebody outside of a family and, and your friend and to maybe get some positive feedback or some like tools to use.
Sure.
And so I'm just starting that journey, but I definitely had times where it was really low. I never stopped taking insulin or anything like that, but I definitely sometimes would just go into seclusion or a solitude. And that would be kind of like how I dealt with things is, and I have a great group of friends, and I always have. Um, but that's when I wasn't doing great, is that I would just not contact anybody and kind of just stay at home or stay in bed, that kind of thing, when
Sure.
it got bad. Hmm.
And now every day is rainbows and lollipops, right?
I wish. Um, no, it's not.
No.
But at least I can't blame it on diabetes. So
That's true. That is true.
especially when I started gaining weight, I was like, I thought I'd lose all this weight when I didn't have diabetes. I just thought, oh, my A1C is great. It correlates with losing weight. No, I just have a body that needs more help. So I have to have exercise and a moderate diet. And dang it,
So, well, then,
I really
question.
did.
So,
Yeah.
because you were on the trial, are you
Yeah.
able to use GLP-1s?
I haven't asked. I have not asked. But in my understanding, type 1s don't use GLP-1s unless there's other circumstances, right?
They can use it off label. In fact, when I was at Friends
I'll
for
think, okay.
Life, a lot of people were
Yeah.
saying that they were actually who were type ones are on GLP-1s.
I love it. So, I did try in a clinical trial. Before I got in, I said, I need to lose weight, and I want to lose weight to get into Vertex.
Yeah.
Um, I just I just had, one of the screening nurses, she just told me that, hey, I just qualified for my weight. So I was like, that's it. Everything else I did, you know, I have all these hypoglycemic episodes. I'm not pregnant. I haven't had surgery. Like there, I have a blood type A, and I was like, oh my gosh, I just need to, if you need to lose 10 pounds or whatever. So, the qualifications were important, and I understood them, but I just thought I want fat and skinny people to get this, because I think BMI is just baloney. But
Yeah, I think BMI
'cause
is
yeah,
nonsense. Yeah.
yeah. So, but it was a parameter, and so they had to follow it, and it wasn't, it may have just been that nurse, but I don't think they would tell anybody to lose weight and call back in general. But I think that nurse was feeling my dread
Uh-huh.
moment, and she says, "Well, why don't you just call back, when you do qualify?" And I was like, "Okay," but no advice, no advice. It was just, um,
And you said you're
but
type A
yeah,
blood, and so you have to be
yes.
type A or AB blood to be in the Vertex trial. Is that correct?
To be in this trial, yes.
Yeah.
So to be in the VX-880 Zymylocell trial, it was derived from, I guess, a type A or AB donor. And so
Got it.
if you're type O, you wouldn't qualify for this one at this time. So,
Right.
and they have other trials as well. And there's so much going on with islet cell trials right now. So, so type O's, don't be just, there'll be other things for you. Um, but yeah, I had more than one friend that as soon as I got in, I wanted everybody to get in. So I was sharing the number. I said, "Hey, see if you can screen in," and
Right.
but a few of my friends got disqualified. One for being a type O blood, and one for taking too much insulin. They're insulin resistant, and you can only take so much insulin in the day.
Do you remember
If
what
you're
that
insulin
number
resistant,
is? Do you remember what that number
um,
is?
what was it? I don't remember the number. I don't think I asked because I qualified, but when they did, they said I take like double the amount of insulin. So if I was taking, oh gosh, 50 units of insulin a day or six, it was something like there was like a max. Um, so you're, so if you received more islet cells, but you were still insulin resistant, you would have a similar result. You might still have to take external insulin, so um,
Mm,
so there's kind of that fact there, for at least this trial, is that it would work, but will it work as well as someone that is more sensitive?
sure.
Yeah,
Sure. Makes
yeah,
that also makes sense.
yeah.
So okay, so switching gears just a little bit, what aspects of living with type 1 diabetes do you think are most misunderstood by people who are not diabetic?
Moods. So you
Mm,
talked about like behavioral stuff. So our moods are almost directly related to our blood sugars.
yeah.
That's my belief. So, I've had so many times where I, had an emotional outburst, and it was either I was crying or I was angry, and, I was doing whatever I do. Maybe like, threw something or pushed somebody, or not somebody, like pushed the door, did something like out of sorts. And
Yeah.
it was because my sugar was high. I was more irritable, and so I thought, man, do I need anger management? No, I needed blood sugar management.
Right.
Because I don't have those outbursts now. But it would be, when you don't want to talk to anybody because your blood sugar is high, and then right after, and it comes down in 30 minutes, 45 minutes, and you're fine again.
Yeah.
Or I would cry, and I'm like, why am I crying? Nobody likes me, everybody hates me. No, my sugar's just 40.
Right.
And
Yeah.
I'm better in 20 minutes, and life is good. I think that's misunderstood.
Yeah.
The moods that you have, the mood changes. You don't have bipolar, or you might, but it's diabetes.
Yeah.
And so I think a lot of psychological diseases and qualifications, um, they could be confused with diabetes distress and fluctuations, specifically with behavioral health and your moods. Yeah.
Right. Yeah. Yeah.
Yeah.
I completely agree. Completely agree.
Yeah.
So, um, Have now that you are again functionally not a type 1 diabetic, have
Oh,
your
yeah.
goals or priorities changed in your life?
Yes. They have changed. I'm starting, and it's really curious to me. So I've always felt like I could do anything with diabetes, even though there were some limitations. I did go to college and I have a full-time job and I'm married, but a lot of people didn't think they could have children, or it was just a higher risk. And it is a higher risk to have children as a woman anyway, but having di diabetes, uncontrolled diabetes, and I opened the door for my dog. Uh, it was a huge risk, a huge risk to keep your blood sugars in line as you, and I never had that option. And I wonder if I would have decided differently when I was younger to have kids. Um, so that kind of comes up for me a little bit.
Sure.
A lot of my friends that have type 1 uh, have children and successful children. But for me, it was definitely a decision. Um, it came into play. I should say it came into play.
Right, right.
Yeah.
So have you set any new goals for yourself where you're like, "Hey, I don't feel like I'm being held back by my diabetes anymore." And
Yes.
yeah.
So travel.
Yeah.
Um, so we've been traveling more, and I've had some travel opportunities, some speaking things come up recently where people want to hear about the cells,
Sure.
and I'm saying yes to more than I would, because traveling alone doesn't seem so scary. I'm not afraid of dying in the middle of the night, not in the
Yeah.
same way. I'm still, I'm cautious and lock the door and everything, but my fear of not being able to help myself in that way is gone.
That's
I am thinking
amazing.
about going back to school.
Oh, good for
I wonder
you.
what, yes, I wonder what like getting a master's degree might feel like
You should
without,
do it. Like you said, you only live
I,
once, just
yeah,
do it.
yeah. So I might go back and get a master's degree. And traveling's already changed for my husband and I. I mean, we, just even going in the airport,
Yeah.
going through the check through is different. And not having to carry the go bag,
Yeah.
the snacks. I've gone so many times without eating, not thinking about it. And no, that's not necessarily healthy, but to have the option to say, I just want a black coffee this morning. I don't want to have my normal, I'm just going to have a black coffee for breakfast and I'll eat later.
Yeah.
That's amazing. Yeah. Sleeping in late, not constantly checking my blood sugar on my phone. But right now I'm still processing everything.
Sure.
I'm getting used to tasting food
Right.
and enjoying food again.
Instead of just eating
And
it for survival. Yeah.
yes, yeah, I was just eating it for some. I don't think I really enjoyed food. I mean, sometimes I would enjoy the taste of food, but I didn't get excited about farm to table or taste this, I don't know, the nutty undertones of this wine or the fruity, I don't know. I just,
Right.
no thanks. It just wasn't as exciting. And now I want a good cucumber and a good strawberry, and I want the sweet potato to taste a certain way. And eating food is really changed.
Yeah.
I eat a little slower, but I want to start processing some hobbies, and I lead a garden team at work
Oh,
and a
cool.
community garden. Yeah. And so I'm learning a lot about growing crops at different times of the year and from seed and seedlings. And it's been just an amazing hobby to take my mind off things and get some exercise. And so um, that's a new focus, but I don't have any really big goals. But things are coming into my life. Some opportunities I didn't think that I'd see are
That's
happening.
amazing.
So
And you need to
yeah.
absolutely seize those because think
Okay, I
about it.
will.
Think about how much brain space has just been freed up
Yes.
by not having to make
Yes.
those 180 plus decisions every single day that a non-diabetic, doesn't need to make.
That's exactly right. So, and I've noticed that, I thought, wow, I feel different. I'm thinking about different things, and I do have more space. Initially, I wanted to manage something. Manage something. I'm not managing my diabetes. I need to manage something else.
Aha.
And so there was that. I do feel that need to have more on my plate,
Sure.
instead of just be still and enjoy life.
Right.
Um, so we'll see where that goes. I think that's where hey, I want to get a master's degree. I want to write a book. Maybe I'll write a book like you, Brian. Um, and so, and that's been a theme my whole life
I
is
mean,
that Patty,
honestly, start by just writing down your own diabetes story. I
I
mean, I
could,
think that would be
right?
very, very therapeutic for you. And I mean, just your journey is something that, I mean, not, let's put it this way. Very few people have ever had the journey that you're on right now. There have been a lot of
That's true.
diabetics, but very few have gotten to the point of being able to say that they are a former diabetic. And
Yeah,
that is an absolutely amazing experience. And
it is.
you need to I mean, not only embrace it, which you're doing, but
Mhm.
you need to write this down.
I know. So I gotta say, I think I received 8 journals from my team at work. I have an amazing team at the health department, and going into so my friends and my coworker friends, they sent all these all these journals to me, all kinds of journals. Like, women love journals, right? And I'm like all these journals, and I'm like, I did not feel like journaling while I
Uh-uh.
was having things in my arms and
Sure.
taking all these meds. I did not. I mean, I couldn't journal. I could, I was actually working remote, and I just remember like kind of pecking on the my laptop, um, because it was more challenging. But I was like, I'm not going to be like writing with my arm right now.
Yeah.
Um, and when I do like to write, I like to do a pen to paper versus typing. So I have written little blurbs down, and I've definitely have a lot of text messages and pictures and emails captured of that have the date. So I'm really glad for that. If I want to compile them, but you're not the only one, Brian, that said, "Get this down on paper, Patty." Somebody we're gonna read this. Not everybody's gonna watch you on these on a video. It takes a long time, but maybe they will read about your story, as I go to sleep one night. So,
Right. Well,
so we'll see. We'll see.
I mean, when you think about it, right? When you think of like the literally the tens and tens and hundreds of millions of people over the centuries who have died from diabetes, right? Before they
Yes.
even
Oh yeah.
had treatments available.
No.
And you're one of 52 in this trial,
Yeah.
right?
Yes.
And in
Yes.
Eladon, one of 12. I
Yes.
mean, I know there are other trials out there, but we're talking about handfuls of people, not millions of people. So you have a
No.
perspective that is so incredibly rare and something that
Thank
all
you.
diabetics, all diabetics alive today want to get to.
Yes. Yes. And I want them to get there too. And um, I do. I was sharing that I wish all my friends were interested. A lot of my diabetic friends are like, "Tell us how it goes, Patty."
Yeah, they're
You know,
scared. I get it.
they're scared. And I thought, you're the ones doing all these other high adventure things. They're hiking mountains and they're doing high ropes courses and I
Right.
don't know, out in the wilderness with black bears and stuff. And they're like, "Yeah, tell me how it goes." And I just thought, really? So my focus has just been so much on how can I get in the trial, and of course, I almost didn't get in. And if I hadn't, I'd be just like everybody watching me now, somewhat maybe jealous or envious, or like, how did you do it, Patty? And I felt very lucky and blessed to just even know that there was a clinical trial
Right.
um, from a friend, and then Google searching and Instagramming, and
Yeah.
I really felt like I just got lost in it online, and I found it. I got lost to get found, and yeah.
And that's your story.
I wish it was very straight. I wish it was a straight path that I could say, get on 95 and just keep going, but it wasn't. Not at all.
Few paths in life were ever straight.
Yeah, it's been all over the place. And some people say you have a lot of grit and all these kinds of things. So you're a pioneer. And I just thought, I'm desperate. I'm desperate. I don't feel like a pioneer at all. I just thought, man, I'm just a lady that got into this trial and it's working for me. And I want to give some hope to other people. I don't know if it's working for everybody. I don't know that
Yeah.
information. My data is with the FDA. And so Vertex has not released my results publicly.
Right.
So I don't know. I don't know how, what they're going to release, what part of the data they'll release, but they capture a whole lot of data on me. I'm
Sure.
constantly giving them my fluids. It's blood and urine. Blood and urine. That's what they're always taking. They haven't taken any
Yeah.
sweat or anything, but they're constantly looking at results, which is great. That's what research is, right? So
Yeah.
I always and I tell my husband if I'm having a hard day adjusting, which I can't believe I'd ever say, like getting the cure, like, shut up, Patty. Like why would you even say that? Well, that's authentic. That's what I'm going through. It's a
Yeah.
big adjustment from every day living with diabetes, which I fully understand to the extent, and then not
Right.
like a magic, like it didn't happen. It's very weird.
Yeah.
I think my mother recently told me that so I lost my father and right before I got the cells.
Oh,
And
sorry to hear that.
thank you. It'll be 3 years this December. And um when I talked to my mother about that journey of grief and love and everything, and sometimes I remember she said, it's almost like, did it happen? Was I really married for over 50 years and had kids?
Mm.
Because it is taken from her,
Right. Right.
her best friend was taken from her and my father. But I I feel like I understand that a little bit of her saying how different her life is without my dad. And how every day is different. You're only cooking for one, and you're going to church just you in the pew, and you know you're shopping for just you. You're thinking about travel, and you're taking care of all the other responsibilities. And so I'm glad that I've been able to work and I've been able to be a pet parent, as my dogs have been barking most of the time
Yeah.
during the interview. But I'm glad a lot of things stayed the same.
Yeah.
I'm glad I have a good marriage and great friendships. I think it would be very hard for somebody that didn't have some of those blessings to go through this kind of clinical trial, but they could do it. Anybody can do it. I know right now it's for adults, and I can see why. There is a hardship in it
Yeah.
that leads to a great reward. And so, but yeah, it's been hard. It has not been easy. Having to be patient for the callbacks and the travel and getting time off of work and things like that. But it's worth it.
That it's
It's
worth
worth
it.
it.
Yeah.
Yeah, yeah.
Well, just one final question here. Is there anything about your experience with type 1 diabetes that I didn't ask but you feel is really important to share?
Hmm.
You could just rail about how much you hate diabetes. That would be fine too.
Well, I limited myself with diabetes because of wise doctors and parents. So at one point, I wanted to go to Africa when I was in my 20s. And I had the trip paid for. I was going to Uganda. Some people that I knew from church were also going out. It wasn't like a mission trip or anything. It was just a trip with some fellow members that I knew. And um, I had everything planned. And I let it get derailed because of diabetes. They said it's a third world country. You could get traveler's diarrhea. You
Right.
don't know the language. They speak so many different languages in Africa. And you're pretty much like you're going to die.
Right. Yeah.
And and so and in my 20s, I allowed that feedback to prevent me from traveling to an amazing place in the world and to have an experience with people that I knew and felt safe with. And I know I could still go back now, but that opportunity was then. And I allowed, that group of people in that time of my life to get overlooked by diabetes because my endocrinologist said I wouldn't want my children to go and they don't have diabetes, right? And I thought, oh my gosh. And so I was trusting all these doctors and I wasn't trusting myself.
Right.
And the same thing now. So I didn't learn about this clinical trial through my endocrinologist. They definitely know now and they share it, but that's not where I learned about it. So it's really important to trust your doctor's information, but there's information in more than one place. And so one of the things that I learned with diabetes that is to also trust your gut, trust your gut intuition, and if you, to explore more. But I definitely had a lot of low blood sugars that were really bad. But I just kind of forgot about the turmoil that other people taking care of me had. I just let it go because I didn't remember it. And I think that was probably one of the hardest things is knowing other people have memories of me that I don't have because they were taking care of me in a seizure or in a coma. I think the longest time I was in a coma was maybe 45 minutes.
Oh, wow.
As my family was administering honey to me and they saw signs of life. So they continued at home and I don't remember any. I was paranoid. I had no idea what was going on.
Wow.
But yeah, so some of those things I could do without. Any restrictions and having these comas and hypoglycemia. I don't miss any of it other than the friendships, and I'm glad that I can still feel. I've been a type 1 more than I've not been. So type 1s like you and everybody else, you're my people. And so, yeah, that's what I feel. So I still feel one of you. So I hope that I'm still included.
Absolutely.
I still get invited.
Not that you'd want to be included, but yeah, you can still be part of the group.
Yeah, I don't want to trade places. I've had enough. So I'll let this play out as it's meant to play out, and I definitely hope that I don't see it again. But if I do, I'll understand it. I'll understand it.
Well, now the good news is that now you're on the path to, racking up those years as a non-diabetic. And so now the goal needs to be to surpass the number of years you were as a diabetic by non-diabetic years.
Yes. Well, what I was saying? I was like, wait, I could go for it. I could be 88. Let's do 88 or more.
You can beat it. Yes.
And that's a number that is a lot of people live past 88. So I get right, Teddy. Do you live past 88? So yeah, he's ready for it. Yeah. So you're right. I hope there's 40 years of that, and maybe getting in some not so harsh immunosuppressants. I can't wait, Teddy. It's okay. I can't wait for all this research to more opportunities for me too.
It seems it seems like we're in a time period where there is faster change in the diabetes world than at least there has been during my 28 years as a type 1.
Oh yeah, it feels like there's so much and so much technology, so much exciting. I go to these, at the Friends for Life, there was all the booths, and at ADCES, there's so many booths with technology, and it's amazing. It's very exciting, and at the time, right before this, I wasn't as interested in the technology. I had my diabetic alert dog, and now we have this new barking puppy that we're figuring out. But yeah, that I would try all the technology too. I think sometimes I get into it and then I don't get into it, but there's so much to explore to make life a little bit easier. I hope a little bit easier, but yeah.
And hopefully someday someone will be watching this many, many years in the future and they'll be like, wow, how did those people survive with diabetes? I hope that they look at it as such a thing of the past, just like polio, right? As soon as they came up with the vaccines, right? Then all of a sudden, no one was getting polio anymore.
Brian, this is why you're a historian. So this is why I'm glad to be a part of this. So they're gonna look back and read who's this Patty girl, and oh my, what did she do?
And oh my gosh, how did
That
she survive that?
How did she survive that? Right. And because so many haven't, so many haven't survived it. And but yeah, I'm a survivor and I'm trying out this new thing, and I'm so lucky and blessed to have felt drawn to do it and felt brave or something or desperate that I'm gonna do this thing. I, I know I did have some bravery in it, but
It's
because
definitely
I
bravery.
continued.
It's definitely
Yeah,
bravery because, it's so easy just to say, "Oh, I'm just gonna continue this course, right? I know
right.
what diabetes is. I know how I've handled it for so long. I'm just gonna continue to do what I've always done." Right.
Yes.
And
Yes.
because change is scary and human beings are programmed to hate change, to be
Yeah. Oh
change
yeah.
averse. And so, yes,
Mm-hmm.
it's very brave what you're doing, no doubt.
Thank you. Thank you. I keep telling myself, I'm like, am I really okay? I'm going to continue. And even if it's hard, I'm going to continue. I want this trial to have great success. And so this trial is 5 years for me, and then I can sign up for another 5 years. And I'm all about the free meds and you can keep, what do you call it? Keep testing me if, even though they do not tell you that it could benefit you. They definitely say very clearly, this may not benefit you, but it has.
Yeah,
So
yeah,
say
I
there's
know
a
that I think they're just
chance. I'm
afraid of
in.
they're afraid of legal liability because we're such a litigious
Hey,
society. Yeah.
yes, but you know what? I'm one that is going to buy a scratch off ticket because I have a chance to win.
I
If I
mean,
don't
you've
buy one,
honestly,
I don't have a chance.
you've already won.
I love that. Thank you. I do feel that way.
Yeah. Well,
Thank you, Brian.
thank you so much, Patty. I really appreciate it. It's been fantastic speaking with you and learning more about the Vertex trial.
Well, thank you so much, and please forgive my the background
Oh,
noise over here.
love puppies. I've
That's
got two
real.
fur babies of my own, so yeah.
Okay, good.
Thanks so
Thank you,
much.
Brian. You're welcome.